Good evening, everybody. This is Dr. Manal Elewah, WHO-CCI Egypt representative. I am presenting this talk or this presentation for the third Apoc Oncology, Hematology International Forum, and it concludes or it represents or it describes or it states the global initiative for childhood cancer. Let me tell you briefly about myself. I was famously known as Fadila, or the mother of Fadila. Basically, I'm a chemical engineer who graduated from the Faculty of Engineering, University of Alexandria, then obtained the master's degree in environmental engineering degree, PhD from University of Washington. I worked as an environmental engineer, and currently I am the environmental editor of the UN Global Environment Report since 2015, one of the group of editors. On 14 March 2003, my life has changed to be the caregiver of my youngest daughter, Fadila, who was diagnosed with standard risk ALL and at the age of 3 years and 9 months. She received her first treatment, COG 1952. Then she relapsed after 6 months of treatment with isolated CNS in February 2006, where she started the protocol, the Apoc 1961. She was rushed to MD Anderson Cancer Center for craniospinal radiation and radiotherapy and chemotherapy. During her treatment, she was introduced to an art therapy program, and since she was very young, I was always with her, attending all the sessions. In 2013, we went back to UAE after she completed, she was announced after remission after 5 years. I founded Art to Care program, which is for art therapy for children with cancer. I received my first art psychotherapy diploma from Bulgaria, and followed by art therapy introduction, foundation diploma from Ireland, and finally therapeutic art therapy practitioners and specialized expressive art practitioners from Canada in 2019. The first time Sheikh Khalifa Medical Hospital in Abu Dhabi has celebrated the Childhood Cancer Day on February 15, 2006, when I have started the Mother Support Group. Now let's talk about the initiative. It started on the 68th WHO Assembly in May 2015, and then the first national workshop on childhood cancer was in Myanmar in May 2016. That started putting childhood cancer within the SDG goals. As an environmentalist, I really understood the path and how it was connected with health lives and how to promote well-being of all ages, which is goal 3 of SDG. There are also links between the cancer control and the SDG goals. Now, how can we get that job done in Egypt? Science for all children with cancer, to access to research. Health for all children with cancer, quality care and cure. Caregivers for all children with cancer, workforce capacity building. 3 steps. The Global Initiative for Childhood Cancer was announced in September 2018 and was launched in 15th of February 2021, which is a little bit more than a month ago. Within these 2 years, a technical package was prepared by a number of volunteers from all over the world. The goal of the initiative was to reach at least 60% of global survival rate by 2030, while reducing suffering and improving quality of life for all children. This was announced, as I mentioned, in SIOP 2018 in Kyoto, the first time about the initiative. The synopsis about the initiative, it was, again, a milestone to be addressed for children with cancer all over the world. The objective of the initiative is increasing the prioritization of childhood cancer nationally, regionally, and globally, and expanding the capacity of countries to provide quality childhood cancer care. Cure All, which is the technical package prepared by the team for 2 years. The package is intended to help the countries to set their priorities, to generate investment case, to develop evidence-based standards and monitor progress. And it has an information portal that has been created to facilitate sharing of expertise between countries and partners. PD cancer facts, we all are aware of the PD cancer facts. So the childhood cancer statistics says that more than 300,000 children are diagnosed yearly. At the opening or at the launching of the technical package Cure All on February 15, 2021, we had Dr. Tedros, the WHO Director General, saying that too many children have their lives cut short by cancer, and survival rates in poor countries are continuously lower than those in wealthy countries. 80% of children with cancer in high-income countries reach survivorship, while in low and middle countries, 20% only of children with cancer reach survivorship. The Cure All technical package, as I mentioned, was launched in February 15, 2021, and it supports governments, partners, and communities to achieve the best possible cancer care for all children. The acronym Cure All is the 4 key pillars, Cure, Neighbors, ALL. We will come to learn what ALL stands for. The Cure package outlines an approach to assess the current situation, to develop action plan according and monitor progress, and includes accompanying tools, standards, and support. So the goal is to reach 60% survival, to reduce the suffering of children, and to cross the line of 1 million lives saved by 2030. These are the ALL advocacy, leverage financing, and linked policies. Within Egypt, the country profile 2020, these are statistics run and collected by July 2020 in general for all types of cancer, whether it is adults or PD. Let's talk about the global initiative for childhood cancer concerning Egypt. It has only few figures that were recorded between 6 different types of cancer, PD cancers and other childhood cancers. We have close to 7,000 cases which are reported yearly. As I mentioned before, there is a big difference between survivorship within developed countries and low or middle income countries. Egypt is in between. The WHO or United Nations has the Global Initiative for Childhood Cancer, has allocated $15 million to implement this initiative. It covers early diagnosis, treatment, and palliative care. When identifying early cancer is more likely to reach better survival rates or better cure rates. The correct diagnosis is essential with children with cancer because each cancer requires a treatment regime that may include surgery, radiotherapy, and chemotherapy. The Cure All Children with Cancer, as we mentioned, has advocacy, leverage finance, and linked policies with governments on national, regional, and global level. There are the technical package covers this with output activities on the global level, on the regional level, and on the national level. The early diagnosis is consisting of 3 components: the awareness of symptoms by families and primary care, the accurate and timely clinical evaluation, diagnosis, and determining the extent to which cancer has spread, and access to prompt treatment. There are cross-cutting enablers, as mentioned, advocacy, leverage, financing, and linked governments. Our first focus was 6 common cancers that can help us to see how working it is. It represents between 50 to 60% of childhood cancer. And these six cancer types are acute lymphoblastic leukemia, Burkitt lymphoma, Hodgkin lymphoma, retinoblastoma, Wilm tumors, and low-grade glioma, which is a brain cancer. By improving the care of these diseases, we can make progress in all childhood cancer. We have this listed here as from addressing the common challenges to connecting vital partners. The GICC, or Global Initiative for Childhood Cancer, focused countries in 2019 were Ghana, Morocco, Myanmar, Philippines, Senegal, Sri Lanka, Ukraine, Uzbekistan, and Zambia. The technical package has been used within those countries as a first pilot plan to study and see the results, how the governments are coping with those requirements. This is to cure all or to the initiative, where they have addressed the main challenges and how the country has covered by studies, by mapping, by awareness campaigns, by meetings. So the GICC is dividing the continent into 6 areas: the Envo region, which Egypt is a part of, Europe, Western Pacific, and South Asia. Access to effective and essential medicine, pathology, blood products, radiation, technology, and supportive care are all valuable, inequitable around the world. However, cure is possible for more than 80% when these services are accessible. So we have activities on the global level, which Cure All is a technical package, support dialogue across sectors to strengthen the cancer care workforce and increase access to medicines and technologies, provide platforms to set priorities, research and exchange best practices, coordinate global reporting on progress. On the regional level, we have common activities to develop and sustain a governance structure for shared objectives and results, facilitate participation in regional practice networks through WHO Knowledge Action Portal, which I mentioned before, support dialogue among neighboring countries regarding regional centers for training, clinical or logistics need, coordinate country-level action and align country strategies with regional priorities. And then we have the country level. Common activities at country level includes use a 4-step process: assess, plan, implement, and monitor or modify to implement a tailored cure-all approach for each country. To summarize, the WHO and the International Agency for Research and other agencies, other UN organizations have partners to increase the political commitment for childhood dialogue, to support governments to develop high-quality cancer plans, to develop standards and tools to guide the planning and implementation intervention for early diagnosis, treatment, and palliative care of which take account all specificities of childhood cancers, to improve access to affordable and essential medicines, to support governments to safeguard families of children with cancer from financial ruin and social isolation as a result of cancer care. The WHO, ICCD, SIOC, and CCI have the global initiative, launched the first project, which is through our hands, the Cure All. This is a global project, has been implemented, the access to current childhood situation, to plan, cost, and finance, implement, program, monitor, and modify. All hands in for Cure All. This is the International Childhood Cancer Day. This was announced globally on 15th of February 2021, on the same day of the launch of the Cure All, or the initiative, the GICC initiative. And it covers a number of steps, 2 projects to prioritize, and it was launched in all countries to participate with a global tree. You can see it on the left, virtual handprints with a message the child writes on the handprint. And it's extended until March 31st of this year, which is a few days. Currently, the results were until Saturday the 20th that 67 countries only participated with a handprint of 1,314. Earlier, last night, we had a 69 country participated. Egypt is not yet displayed on this handprint tray or this global initiative. A few days ago, we had the conference in Mumbai, virtual conference. The CCI also have met, and we had a number of presentations where we discussed about the priorities and how the CCI, the WHO-CCI country representative will start to implement or start to make official presentation about the initiative in their countries. This was the list of priorities to be discussed. Analysis of cancer health system available on the country level, the national cancer control strategy development and implementation of cancer workforce training packages, the national network and referral pathways strengthening, defining national standards and guidelines for index cancer, essential. And then it goes until the local and regional advocacy portfolio, case studies, and awareness campaigns. On the country level to be implemented, then on regional, there are numbers of other projects to be implemented on the global level. So the strategic activities by level of action has defined the role of each continent, of each area, and of each country. This is a hospital footprint or footprint in hospitals that has been done by India. I would love to see Egypt have a footprint within the PD cancer hospitals displayed as such. I have also come to learn that the Apoc is by the end of each month launching the statistics and having all the numbers available on the social media, which is also one good thing that we need all PD cancer centers or premises in Egypt to abide with this. So the Global Childhood Cancer Initiative aims to save the lives of 1 million more children by 2030 and improve the quality of life of all children with cancer. Egypt, where we stand. A lot of scattered efforts are carried out in Egypt, but we need to compile all these efforts. Hospitals and clinics, public and private, NGOs and associations, we need to join hands. I hereby raise my voice to all of you to nominate a coordinator from your organization to connect with me so we can start our journey together, aiming to save more pediatric cancer patients in Egypt, in Africa, regionally and globally. And always remember, never give up, and we complement each other all the way. You can contact me or connect with me via mobile, WhatsApp, email, LinkedIn, Facebook, Instagram. In person, I'm available. I wouldn't say 24 hours, but mostly 24 hours. Thank you.
Thank you, Dr. Manal, for your very nice presentation. At the end, I would like to know from you, because this question came from to me, is what are you going to do in Egypt as first step now?
As first step, I would have a similar presentation or simpler presentation than this one, with defining the goals and starting to compile a database with all the PD cancer centers, as I mentioned, whether it is a government center or a private center or a hospital or clinic, all the premises, the establishment dealing with PD cancer. Then we can, at the second step, we need to do the mapping, which is mapping of services available, whether it is equipment or personnel working with the kids, because this is like, a multidisciplinary project, where to find the services, how to deal with it, how to reach it, and what is presented there. Awareness also, not only for people working within the field, awareness for families, awareness for parents, awareness for schools, awareness for siblings. Let's remove the stigma of cancer patients, because lots of families consider it is a stigma and they hide when their child is diagnosed with cancer. They don't want people to know that the child is diagnosed with cancer. And also another stigma, which is the child diagnosed with cancer, that means death. It is not death, it's just another form of life. Life is changed phases for us. It's a different norm that we have to get used to. These are all things that we need to combine. I know that there are lots and lots and lots of projects and lots of programs around, but we need to combine all this and use the knowledge action portal, which is going to be offered by WHO. A number of sibling countries around us, Lebanon and Morocco, has a lot of training packages already in the portal. We need to have Egypt as well present with whatever we have, whatever we can give to help our kids and other kids as well.
Thank you very much, Dr. Manal. I wish you a very good luck with the initiative here in Egypt. And I would like to begin by inviting you to our hospital to begin your initiative.
The pleasure is mine, of course.
Thank you very much.